Imagine you broke your tooth, then you walk out with a brand new one, no metal, looks extremely natural, no pain, and no grayish hint. So today we're going to talk about the metal-free crowns and bridges. Before I keep going, make sure you put code DENT81, DENT 81 to get a free consultation in our luxury dental office in Princeton, Blanche Dental. Consultation for porcelain crowns or teeth whitening or porcelain veneers. And before I keep going, make sure you like, subscribe, and comments, in the show note down here if you have any questions. My name is Dr. Saad, and I am your host today. And we're going to talk about how new technology, it's not really new, but how metal-free crowns and bridges can replace, your missing teeth, or if you had old metal crowns, how they can be replaced and just to look very natural. So we're going to talk today about the CEREC or the CADCAM technology. So many years ago, how I was trained, we used to do the porcelain fused to metal. And what are these? It's the regular crown that you take an impression or take a mold and you send it to the lab, and they send you that crown, that's metal on the inside and porcelain on the outside. You put it in, it looks fine. Sometimes the color is a little off, but it works. And after a few years, you start to see like a gray line. And you look at yourself in the mirror, is that a cavity? And why when I smile, I see like a gray line around my tooth? That's not a cavity. You go to your dentist, no, that's not a cavity, it's just the metal showing. Oh my God, so what am I gonna do with this? Can you cover it up? Can you fix this? It's still okay, don't worry about it. That's if it's an older dentist, like old school. But now there is a lot of new material out there. I hate to tell you this, guys, but we can fix this in one day only, and how we can do that. So let's go talk about dental materials now. So basically, there is porcelain fused to metal, and now the newer material is zirconia and e.max, or the lithium disilicate. What are these? So these are basically some sort of ceramic material compared to the porcelain fused to metal. Years ago, metal, it used to be sometimes like completely metal with this, whether it's like a gold crown or a silver crown or something like with an alloy. And then, especially in the posterior, then, okay, we'll make it a little bit better. So they started to put porcelain on top of it. And in order to do that, they had to put an opaque material on the metal to mask the color of, like it's gray, it's black. To put opaque porcelain and then put the porcelain on top of it. So when you smile, it looks very unnatural because the light is not going through it. When you are smiling, you need to see the light go through. But then because of the opaque and the metal, the light basically gets stopped. So they started to work on this, and now we have the porcelain or the ceramic material, which is porcelain or zirconia. And why they are different. Porcelain is the nicest, the most aesthetic material ever. Whether it's an e.max or if it's the old style porcelain. Okay, feldspathic it's called. And the feldspathic, it's basically done in the lab. They just put porcelain powder, and they start to mix them together, and they start to put like different layers, a little bit of basically around the gum, make it more characteristic, a little bit of yellowish here, a little bit of translucency bluish on the edge, so that when you're smiling, it looks very natural. But now e.max came, and what's e.max? It's lithium disilicate, it's porcelain, but it's being milled. So it comes out, like basically closest to the shade that you have. And then in the dentist office, if you go to a really good dentist, then they can do characterization. We do it all day long, basically. We do characterization just to make it more natural looking. So a little bit of staining a little bit around the gum line, and on the edge, we put like some bluish incisal translucency. When you're smiling, it looks blending in, completely natural, all on the same day. And it's very strong. It's a very strong material. So basically, we used to say, grab a hammer and try to break it. It doesn't break. Of course, but don't try to do that, not in your mouth, of course. Zirconia, it's a beautiful material too, but I would not, and I repeat, I would not use it in the front. I would use it in the back. And why is that? Because zirconia, if it's not layered zirconia, so it still, the light doesn't go through it. So I'd rather use it in the back, second molars, first smaller in the back. That's, you know, it's still beautiful, but it's not as pretty as porcelain. Now the e.max or the ceramic, the lithium disilicate, they have different translucency too. So there is the low translucency. It's basically, let's say you have a couple of crowns and I'm trying to match them. I don't want things to look very odd, so I would use some low translucency to kind of make it blending in. It blends in. If you had no crowns at all on the side, so I want to use something medium translucency so the light goes through it even more and it looks like you can't even tell. Then there is the high translucency. I'd rather use that with veneers. Why? Because it looks completely, totally natural. So now we understand now the porcelain fused to metal, old style compared to the ceramic material, and why the ceramic are better now, because they have the same strength, if not even stronger than the porcelain fused to metal, but also they're very biocompatible. There is no metal in them. They're biocompatible with the body, and especially with people who have some sensitivity or even allergies with metal. I had a patient actually 2 weeks ago. He had a bunch of porcelain fused to metal crowns. He hated them and he always felt bad. Somehow his body was not, and he had them for years. And he came to me and he's like, I just want to have these replaced. I hate them. Every time I smile, like I see metal and I don't feel good. We replaced them all. I put porcelain, completely pure porcelain. They looked absolutely gorgeous. You can go check on my Instagram, guys. Everything is actually, if you go on my YouTube up there, you can see the links to my Instagram, and you know that we have Spotify and Audible and everywhere. Basically, the podcast is not just on YouTube, but it also goes everywhere else. So I replaced them all with porcelain, and he came to me 2 weeks ago. It was like, I think I had them done like 2 or 3 years ago, and he said I couldn't feel better. He travels a lot. He goes a lot to Europe, and he's like a big businessman. He's like, I feel good. I don't have issues at all, like health-wise. Before, he was not feeling well. He would feel sick. I'm not saying, you know, but it could be really that he was having some sort of reaction to the porcelain fused to metal. So, I mean, if you have this, maybe it's time for you to have those porcelain fused to metal crowns replaced, or even if you have some old silver fillings, they need to be replaced as well. Get some white fillings or porcelain crowns or zirconia crowns if it's in the back. Okay, so now the strength, is it strong enough? So I actually was lucky enough. I went to their headquarters, to the company headquarters, the Ivoclar company, and I'm not affiliated with them, but I use their material a lot. And they said, would you like to see how they're made? And I said, sure. I went there and I saw a huge machine is trying to break it, and it was barely cracking it. And I'm like, this is just insane. So the strength is really there. And of course, with the strength comes, you know, other stuff. So let's say you have the crown. If you don't maintain it properly, if you get cavities and you're not flossing, then they're not warranted. You have to understand that. If you have a crown and you disappear for like 3 years and then you go back to your dentist and you like, the crown came off. I haven't seen you for like forever. So you guys have to understand that, you know, every time you have something done, it's basically, it's the bite, the occlusion is adjusted to your current situation. But with time and age, your teeth, they shift. So every time you go, if the bite feels off, or if you can tell your dentist, you know, like, I'm biting, I feel something is off, or if you grind your teeth, you have to tell your dentist, because they need to check the bite and maybe adjust a little bit more. Okay, if you have basically like a smile makeover, or you have a whole bunch of new crowns or new porcelain veneers, you have to wear a night guard. And I'm talking like not the hard one, or not the one from the store, the really chewy one. You need something called hard and soft, and it's usually soft on the inside to work like a cushion for the crown or the porcelain veneers, and from outside is hard to protect the rest of your teeth. It's very important. Okay, so this is, you know, this is the point to take today. Okay, if you are getting smile makeover, porcelain veneers, or porcelain crowns, a night guard is very, very important. And of course, you have to go for your checkups and cleanings, you know, every 6 months. And when you floss, also pull it through. Don't try to pull it down. Now, are these materials strong enough to hold a bridge? Yes. Yes, I do it all the time. We have missing teeth here or here. Patients, I don't want implants. No, I said, okay, well, it's your standard of care really to get implant, but it's, you know, it's a good option to get a bridge. So we put them in the posterior teeth too, all done on the same day. And how is that possible? Because we don't do the gooey material no more. We really, like, I really scan your teeth. I have an amazing staff. So we scan your teeth before, and let's say you have a front tooth that I want the crown to look exactly like this, so I can scan it and make the new tooth looks exactly like I make a copy of it. Or let's say this tooth broke, but you have the other one, so I can scan it and flip it over and be like, okay, I'm making a bio copy of this, and you look at yourself, they look extremely symmetrical. So the smile is really there. Yeah, we do a lot of stuff in our office. We're very like ahead of the game. But bridges, yes. And the even more exciting things is because I place implants too, so I can restore the implant. Like I can, so the implant is basically like the root, but the top part, the crown, I can put that, I can make them in the office as well on the same day. Not on the same day of the implant placement, but usually we put the implant in, we let it heal for like around, you know, 4 to 6 months, and after that we put a healing abutment, like a little screw, and then after that we bring the patient and we scan for the crown. And usually I do it on the same day. It takes like around an hour and a half, and you're done. A bridge takes a little bit longer, around maybe 2 hours, and a regular crown, like just a crown, takes around an hour and a half as well. If you're getting a root canal done and a crown done on the same day, it takes around 2.5 hours because root canal is involved too. And I mean, if you are looking for a dentist, you know, we are in Princeton, New Jersey. The address is in the is here, and you can also find our website, and then you can find us or basically look at what we're doing. And you can follow me on Instagram as well, and you know, all the fun stuff. Okay, now I think the best thing is really the same day thing, because we get a lot of like executive and patients, you know, who are speaking or speakers, or, and then the tooth broke, and it's like I had a patient the other day. He's a neurologist, and he speaks, and he was going to a conference the following day, and his front tooth broke, and he's like, what do I do? And I said, just come, we're gonna squeeze you in. And that's basically what I did. I remember I scanned the tooth next to it, and I made a copy, and then we flipped it over, and it looked exactly the same, symmetrical. Took us like an hour and a half, and he couldn't be happier. And so yes, so the new material, it's not really new because the technology has been out there for like over 40 years, but this is called the CADCAM technology, or the CEREC. That's the most famous, the company really. CADCAM is computer aided design and then computer aided manufacturing. And in order for the dentist to do that, of course, you have to get like a really good training for this. And I've been doing this now for like almost 12 years. And I didn't look back, because it allows me to help the patients, and we get the results like right away. And one time or a couple of times, if the color is a little off, I can just push the button, put a new block in, and I can make another crown, or I can stain it to make it a little darker, and we're good to go. I actually had a patient last week, very sweet lady. She's 83, and she is a teacher. Not a teacher, she's a professor, actually. She's a university professor, and she still goes, you know, to teach at the university. And her front tooth broke. She said, I am not getting an implant. I am not getting, and I said, okay, well, a bridge. She said, yes. I had to pull the tooth, and I put a temporary, because I don't want her to walk around. It's her front tooth. And then I brought her back, and I said, let's do this color. She's like, I want them to be blending in. I don't want them too white. I said, this is the good color. No. Anyway, so I milled the bridge, and the color was a little darker. She hated it, absolutely hated it. And I said, it's okay, no worries, just sit tight. And I went and I milled another bridge, the same color that I recommended before, that's a little lighter, because with the little lighter, I can always tone it down. Remember, we do some characterization. She looked at herself, her whole face was lighting up, and she goes, oh, I like that. And I said, yeah, you see, it works. And I tried to explain to her about the high translucency, low translucency, and she was like, oh, it works. I said, okay. Even the cement, the glue that we use underneath it also, we can change, we have different shades of that. So there is the transparent one, so the tooth underneath it can basically kind of shine through it. So if it's too, if the porcelain is a little lighter and the tooth is a little darker, it blends in more. That makes sense. Then we also have the cement, the glue underneath, that's a little bit whiter. So that can make the teeth pop, like the color would pop a little bit. Then we also have a cement or the glue that's opaque. Let's say you have a root canal in the tooth and the tooth is completely dark, like black, or they put like a cast post, like a metal post, and it's like dark. How am I gonna, if I put transparent on that and you smile, it's gonna show through it. Remember, it's the translucency. So we put opaque, and then this is when I use the low translucency material. I'm just trying to explain to you. Yeah, but I mean, the metal-free crowns or bridges, they're out there. They can be done on the same day. The crowns for implants are there and they can be done on the same day. And if you're looking for a dentist to restore them on the same day, or if you broke a tooth, remember me, Dr. Saad, and I am in Princeton, New Jersey. And I hope you enjoyed this episode. And let me know in the show notes here if there are like specific questions that you guys have. I'll be happy to actually have a whole podcast about them, just to explain or talk more about it. And remember, if you take care of your teeth, they will take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.